Chelsea Kretz. I'm one of the public information officers here at the Grand Prairie Police Department. Today we're going to learn more about one of our most recent hires, Miss Courtney Runnels.
Hi.
She is the Grand Prairie Police Department's first ever mental health coordinator. Her position is something that has been in the works for the past few years, and it's a very exciting time here in Grand Prairie because we are always looking for innovative ways to better serve our community. Grand Prairie is one of the few cities in North Texas that's actually taking this approach with your position here as a civilian mental health professional. She's here to serve our officers, you're here to serve our community, and without further ado, I would like her to talk more about herself.
Thanks, Chelsea. So my name is Courtney Runnels. I'm a licensed professional counselor, and I've been doing this work for about 15 years now. I also have a private practice where I specialize in serving our first responders, and I'm really excited to be here in Grand Prairie to build and start this new mental health program and see what we can do to help out our community.
Perfect. Like I said in the introduction, we are one of the few departments in North Texas that has employed a mental health coordinator. So can you tell us why departments are starting to do that?
Yeah, so with when we saw deinstitutionalization from our mental health hospitals, we thought that people would go receive services from our community mental health facilities, and there just weren't the resources that we needed in order to serve that big of a population. So we really saw our officers become our first responders to mental health crisis, our social workers. And so with that, they didn't have the correct resources to get them the help. And so we found that people were just being taken to jail because we didn't have anything else to do with them. So with this new position, we're really working to reinstitutionalize back into treatment services rather than the criminal justice system, where it's more appropriate for them. So I wear many hats. One of the biggest facets of this position is partnering with the officers, and so we're going to respond out on scene during the mental health crisis. We help with the crisis intervention. We help with the de-escalation. We help determine what the most appropriate level of treatment is for that person, and we work to coordinate that. We also do follow-ups after the fact. So if somebody's come in contact with law enforcement and they've been to the hospital to get stabilized, then we can follow up with them for that continuity of care piece and make sure that they are plugged into the correct treatment providers that they need. I serve as an advisor on our crisis negotiation team, and I also am our peer support coordinator. So I help do our internal support for our officers who witness trauma out on the street and how to better handle those situations.
So can you elaborate on the type of training that you're going to provide to our officers?
The things that we're focusing on the most right now are our 40-hour crisis intervention training and our 40-hour mental health police officer certification. Both of those trainings provide officers with different signs and symptoms of mental health, different ways to communicate with persons in a mental health crisis, and also different de-escalation tactics so that they can utilize those when they respond to mental health calls.
And so, having trained police officers in de-escalation tactics, how does that potentially decrease use of force scenarios?
Yeah, so officers are forced to respond to the choices of people on these calls, and in a split second they have to make a decision on what exactly is going on. So if we can give them the knowledge and the signs and symptoms of what they're seeing and what they're encountering, and they can utilize that toolbox, and they can use different de-escalation tactics, and hopefully the situation will calm down so that there is no use of force.
Okay, and then can you talk about ways members of our community who are dealing with friends or family members who need mental health assistance, how can you be there to support them?
Yeah, so it's definitely all about the community. We're out there to follow up with persons. We're out there to let people know what resources we have available in this community. I also work with family and friends who contact me and say, I have a loved one who is in a mental health crisis and I don't know what to do. I don't know where to get them help. And so we're able to provide them with that help and that assistance so that they can get treatment. Also been able to assist people in our homeless population, and so coordinating whether it's getting them into a shelter or getting them hooked up with a caseworker that can better meet their needs so that we can have better quality of life.
And your job is not 9 to 5?
It's not 9 to 5, no. It's 365.
Well, Courtney, thank you for being here today. Is there anything else you wanted to add? Or
I don't think so. Just thanks for everybody for for supporting this position. And if you have any questions or comments, please feel free to leave them, and we'll be happy to answer those questions for you.
All right. Well, thank you. Thanks. Bye.